All in our last class we discussed about the introduction and definition of schizophrenia, and today class we are going to see the etiological factors. So before going to that etiological factors, if you are looking at the epidemiology in psychiatric hospital, the 15% of cases are with schizophrenia only, okay, and the 50% of bedded are occupied with schizophrenia. And while we look at the prevalence, right, schizophrenia will affect both males and females simultaneously. There is no gender differences. Next we are going to see the etiological factors of schizophrenia. Okay, here the schizophrenia etiological factors are divided into 4 groups. Okay, 4 types of etiological factors we can see here. So the first one is biological theories, and the second one is psychodynamic theories, and the third category is vulnerability stress model, and the fourth category socio-economical factors. Okay, so we will see the first etiological factors of the schizophrenia. So in that, first one is the biological theories. In these biological theories again divided into 4 categories. Okay, in that first one is biochemical theories, and second one is neurostructural theories, and third one is genetic theories, and the fourth one is perinatal risk factors. Okay, here we will see each one. So first one is the biochemical theories. In these biochemical theories suggests that there are some changes in the neurotransmitters which will lead to schizophrenia. It's nothing but these are some chemical messengers which may help to transferring some signals from one neuron to another neurons in our brain, that we call as neurotransmitters. So there are some variations occurring in the neurotransmitters which will lead to schizophrenia. And we all know the dopamine is an important neurotransmitter in our brain, and there is some variations or fluctuation which may occurring in our dopamine receptors, then which will lead to schizophrenia. In one more condition also we can observe the dopamine level insufficiency, that is Parkinson's disease. That's why we will use the antipsychotic drugs in the patient who are affected with the schizophrenia. Okay, so while we using this antipsychotics, what's the mechanism of action of the antipsychotic drugs means, so it will block the D2 receptors, dopamine 2 receptors. It will block the D2 receptors, there are the chances for decreasing the dopamine level. That is what we will, when we give the antipsychotic drugs into a schizophrenic client, there is a chance for getting some extrapyramidal signs and symptoms. One of the major extrapyramidal symptom is this Parkinson's. So here we can see the some relations between the schizophrenia and Parkinson's disease also. In the condition of Parkinson's, there is a decreased level of the dopamine will occur, while we look at the schizophrenia means there the increased level of the dopamine will occur. Okay, and rather than the dopamine, other neurotransmitters are also there, that are prostaglandins, GABA, norepinephrine, acetylcholine, etc. Variations are occurring in these. Any neurotransmitters also will cause the schizophrenia. So that is what the biochemical theory. In biological theories, the second category is neurostructural theories. So neurostructural theory says that structural abnormalities will occurring in our brain which may lead to schizophrenia. Okay, and also suggests that if you are taking an CT or MRI of the brain who are affected with the schizophrenia, there we can observe some abnormalities like lateral and third ventricles are seen large here in the patient who are affected with the schizophrenia while we check the CT or MRI. And there are some atrophy will occur in the frontal lobe, in the cerebrum, also limbic system. Limbic system will help to produce emotions. So there are some structural abnormalities will occurring in the limbic system also. Okay, and also we can observe the decreased blood volume in the brain, and also the sulci which will going to increase. So sulci means nothing but there are some folds we can observe in the brain. The third one in the biological theories are genetic theories. Okay, genetic theories means nothing but in the name itself, and also the parents who have done the consanguineous marriage couples are also having to get the schizophrenic children. And also identical twins here, there is 50% of chance for getting the schizophrenia in both children. The fourth categories come under the biological theories are perinatal factors. Okay, perinatal or intranatal factors. There are some chances of complications will occur during the delivery time or labor time. So at the time that also lead to schizophrenia. For example, maternal influenza. Okay, if the mother having influenza, there is a 50% of the chance for getting schizophrenia in baby. Late winters and early springs, if the mother become pregnant in the late winter or early springs also, there is some but it's not confirmed, but there is a chance for getting schizophrenia in the baby or children. And there are some intranatal complications also during the delivery time. There is a chance for getting some complications like anencephaly or any instrumental complications, etc. So that also will lead to schizophrenia. Okay, and next we are going to see the psychodynamic factors which may affect the or which may cause the schizophrenia. These psychodynamic factors also divided into two types. First one is developmental theories and the second one is familial theories. Okay, the developmental theories included psychosexual theories. What the theory says means the person who are having the affected with the schizophrenia, there is the chance to regression to oral stage. So okay, and the next one is the familial theories. Familial theories means nothing but if the mother who are overprotective or cold personality, there is a chance to get a schizophrenia in the child. And also dysfunctional family system, like if the parents are divorced or which may occur in between the parents, that also will lead to schizophrenia in children. And the third major etiological factor is vulnerability stress model. So vulnerability means what? It's risky people. So vulnerable means risky people. So that is nothing but the risky people. That is, if the we discussed about now that is genetical factors. So for example, in my family there are someone are having schizophrenia, and for me there are some structural or genetical abnormalities are there. I am leading my life very happily, or there is no stress in my life. There is no chance for getting schizophrenia for me. Okay, instead of that, in my family members having schizophrenia and I am having the some genetical abnormalities or any neurological issues, and also I am leading my life in a stressful manner, then there is a chance for getting schizophrenia for me. Okay, that is what the vulnerability stress model is saying. That is. Next one is the social factors. The social factors means what? There are some social factors means nothing but a socio-economical status. Okay, if the family is very poor and there is a low socio-economic condition, there is a chance for getting schizophrenia in that persons or in that children. That is about the etiological factors of the schizophrenia. So I hope all you understand, and thank you for watching.